Greetings, my name is Ogan Gurel, and I'm speaking to you from Seoul, South Korea. I very much appreciate the organizers of this Welfare Roma conference, and in particular Georgia Zunino, for the kind invitation, and of course the honor and pleasure to present to you here today. My topic is leadership and the 6 T's of the pandemic response. So I'll be talking about basically South Korea's response and how it relates to leadership. And the outline will have several parts. First, some overview of epidemiology. 2, more about transmission, which is of course very important to the social measures to control this pandemic. 3, specifics about South Korea's response. 4, the 3 T's, which is the encapsulated summary of South Korea's response. Then I will introduce what I call the 6T equation and the implications of that for leadership and trust. So now a little bit of background. When we look at infection, infectious disease, there are essentially 2 factors that we keep in mind. One is the fatality rate on the vertical axis. The second is the transmissibility on the horizontal axis. And in general, for most pathogens, the fatality rate is inversely related to the transmissibility. In other words, more transmissible, less fatal, that's down here, and less transmissible, more fatal, up in the upper left here. Now, it turns out that the new coronavirus, SARS-CoV-2, which causes COVID-19, is in this middle space. It's the perfect pathogen. Not so fatal and not so transmissible. And by comparison, seasonal flu and Spanish flu are located, as you can see. So a little more about transmission, the horizontal axis. And that's described by the R-naught. So what is R-naught? R-naught is the number of people that are infected from an initial case, and the SARS-CoV-2 virus has an estimate of R-naught about 2 to 2.5. That is not necessarily the number. That changes, as I'll describe, and that's the basic reproduction number. It's the number of cases generated by one case. And R greater than 1 means exponential growth. R less than 1 means it will eventually die out. The effective reproduction number, R, is the number that is in a population after some people get immune, whether by herd immunity or a vaccine. So the R may change over time. So there are 2 factors influencing this R. One is the intrinsic factors, the nature of the virus, and the R may change with mutation. The other one, which is very important for our discussion, are the extrinsic factors, which relate to the nature of the population. In other words, how people are gathering, the social contacts, and so forth. So the R changes with the situation. So in terms of the virus, how is it transmitted, how long is it viable, how long is the incubation period. Now there's an equation called, to describe the R-naught, that has 2 parts. The beta, which are the infectious producing contacts, that's related to social distancing and other protective measures like masks, and the tau, which is the mean infectious period, which is related to finding, isolating, and treating infectious people quickly. So time is a very important element, as you can see highlighted in blue. So now let's talk about South Korea's response. It's focused, of course, on these extrinsic factors to influence the R-naught. And the primary mitigation strategies around the world have been an enforced lockdown, like in China early on, an unenforced lockdown, like the EU and the United States, voluntary social distancing, like Korea, and minimal restrictions, in other words, a herd immunity strategy, like Sweden, and early on, the UK. So let's focus on South Korea. 4 elements led to a good response. 1 is intervening fast. 2 is testing often and early. 3 is the tracing. And 4 is engaging in the public's help. So intervening fast was pandemic training, early development of tests, containing the early outbreaks, testing a lot, expanding the definition, testing many people, the testing centers, the drive-through stations, the walk-in centers, and so forth. The contact tracing using a variety of technologies such as credit cards, CCTV, GPS, mass messaging, surveillance, isolation, and apps. And of course, the public's health with a diverse array of messaging from television broadcasts to subway station announcements, smartphone alerts, emergency SMS, and so forth. All of this relates to this equation. R-naught is the beta times the tau. The beta are these light-colored, and the tau are the blue, which is the time element. And the small things count. This is a government office in South Korea. You can see there's a hand wash available. There's a sign instructing people where they can get masks. There's a barrier separating the employee from the visitors. Cleaning of public spaces, of course, in public spaces, also fever checks like office buildings and so forth. So this is the three T's which summarize South Korea's response: test, trace, and treat. And the country plans to promote the so-called test, trace, and treat throughout the world and propose related regimes to international agencies. So this has become quite a big deal, not just in Korea, but globally. So let's go in a little bit more detail. In testing, and I apologize for the Korean language here on this global site, there's a drive-through testing, as you're aware, that speeded up the process and expanded the process. Self-diagnosis app, so people can look at symptoms and other aspects, not just the tests. Tracing in terms of technologies such as credit cards, GPS, CCTV, and so forth, and the monitoring of these contacts. So someone is isolated and having people visit them, calling them, and monitoring by GPS in an anonymized fashion. And then treatment, classifying patients, those that require hospitalization and other centers, so we don't burden the healthcare system with all the patients, but only the ones who need it. Special COVID hospitals to separate out from the general sick population, and clinical testing and R&D of drugs and vaccines. So that's the three T's, but I would propose that the six T's, especially in terms of leadership, is a better way to look at this. And the six T's in particular has the element of time. I would call that the fourth T. Now you might take that for granted, but time is very important. Very early and quickly addressing this issue is extremely important. You can see that that relates to the tau here. So time is the denominator in the 6T equations. Let's look at this a little bit more. So the 6 T's, of course, are based on the 3 T's: testing plus tracing plus treatment. But you divide by time, so shorter time is better. You get a bigger value to the equation with a shorter time in the denominator. The 5th T is transparency. And notice that it's not just another name on the list, it's a multiplier. Transparency, as the military people would say, is a force multiplier. And in this case, it's a pandemic response multiplier. So regular, non-political briefings, as was done very frequently in Korea, are very important. Now, all of this equation comes together and relates to trust. So you might say, why not just list these: test, trace, treat, time, transparency, trust, versus an equation which looks more complicated? I would say managers go with lists, leaders go with the complex interactions of all of these. So all of these are not equal. Time has to be as small as possible, and it impacts on the testing and tracing and treatment. And then the transparency is a global multiplier of all of this. And of course, you add that all up and you maximize the trust. And with that maximized trust, which is leadership, everything can be more effective. So Korea has attempted to aim for global outreach. This is the World Health Assembly back in May. And global leaders, including Moon Jae-in here, and Angela Merkel. I think the one thing about this is that even though Korea is very rightly proud of this response, it has to make sure it's not just a Korea-only centric type of approach. And the flags here and all this are not necessarily in the spirit of this global cooperation. Humility is very important for leadership. So let's talk about that. So as you know, COVID-2 is not just out of the blue. There's a history of these coronaviruses. So SARS in 2002, MERS in 2015, and COVID, of course, now. And green, red, green means to indicate that Korea's response with SARS was very good. The response to MERS was outside of the Middle East the worst, and Koreans know that, and that was a real shock for the system in 2015. And of course, the response to COVID, very good. So a sense of humility is very important. In fact, one of the reasons why Korea is very good with COVID-19 was that humbling experience with MERS. Now, there's a specific story related to this. Now, Dr. Park Sang-chol was one of the head epidemiologists who was leading the SARS effort, and I had the honor of meeting him and working with him, actually. And he actually tragically passed away of a rare cancer in 2014, just before MERS hit. So Korea was lacking that leadership. Leadership is very critical in all this. And of course, that's based on trust. So grazie mille. Please take care. You can reach me on LinkedIn and feel free to connect, and happy to engage and discuss this important topic further. Thank you very much.